Whenever a disaster strikes, like this 7.0 magnitude earthquake in Haiti that killed an estimated 140,000 people, a Baylor Scott and White disaster relief team is responding, often within hours.
Because we have the resources, we become the coordinators for disaster relief for Baylor. We've also helped in Joplin, Missouri, Moore, Oklahoma, West Texas, Tokyo, Japan. Everything from beds and stretchers and exam tables down to crutches and wheelchairs, on down to gauze and sutures and syringes and blood pressure cuffs and monitors and everything else. It's much more than the physical presence. We're giving hope to people.
The Joel T. Allison Faith in Action Initiative is a 7-year-old program at Baylor Scott and White Health. It's a relatively unpublicized, multi-million-dollar philanthropy effort that goes well beyond disaster relief and fulfills a higher aspiration.
It's a symbol of Baylor's great support and concern for people of all faiths and those of none all around the world. We have a soul, a heart, and not just look solely at the bottom line.
Faith in Action began as the clearinghouse for unused medical equipment. For many employees, it's become a reason to remain here.
One of our employees at Baylor Plano said to me, "This is the reason I want to spend all my career at Baylor."
Okay, 1, 2, 3.
So I would hope that every individual in the system would see that there is a very, very important faith component to what we do, and it guides and drives us to be people of excellence.
Faith in Action supports employee volunteerism, offering $500 scholarships and supplies for anyone taking a philanthropic international medical trip. It also supports an electronic daily devotional with dozens of in-house volunteer writers providing the inspiration.
We have this wonderful program called Sacred Vocation, which is where leaders, nurses, physicians, and patient techs spend 6 weeks asking themselves, what is my calling? What do I want my legacy to be? Because if you don't include somebody's spiritual life, their religious life, their deepest values in your plan of treatment, then you're not giving holistic care. If you're willing to put your own faith to the test by seeing how well you can serve a human being that's not like you, then you begin to see some marvelous things happen.